At what stage could we see governments shutting down schools, workplaces and enforcing work from home, etc.? The UK, for example, is now at 80 cases. When would you recommend starting social distancing as a preventative measure? The most important ways to slow down the spread of these types of infectious diseases is to 1. Identify infected people, 2. Keep them separate from non-infected people, 3. Track any close contacts to test them and keep them away from the general population as well. A lot of this is based on how infectious and dangerous a particular pathogen, germ, is. At this time, the hope is that governments will work closely with the public and their public health infrastructure to make these decisions in the most effective way possible. As responsible citizens, we should demand accurate information from our governments and socially isolate if we feel sick or know that we have been exposed to someone who is sick. Informing your healthcare provider right away is key. WebMD. What is the outlook for someone who is immunosuppressed due to an organ transplant and is infected with COVID-19? Is there any examples of this happening, or if not, can you talk about what the outlook for a person might in that condition, catching COVID-19 while on immunosuppressant drugs for an organ transplant or otherwise? Thanks for your time. Not a lot of information. The AST guidance is here, Dr. Carlos Del Rio. Are there any evidence of aerosolized transmission? This is an important question and one that has not been entirely worked out. The evidence thus far suggests that this virus transmits like other coronaviruses, and is usually considered a droplet-transmitted virus. It survives in droplets from someone's cough, for example. This means that the virus will fall to the ground around 6 feet, 2 meters, after being expelled from a cough. Whether the virus can actually remain viable as a true aerosolized virus, not in a droplet, think of it like floating in the air, remains an ongoing question. The virus likely does transmit on surfaces though, and people should wash hands and not touch faces. Michael Mina, MD, PhD. What else would you recommend to prevent the virus besides the usual hot soapy water, avoiding those who have it and cover when coughing and or sneezing? Would a proper diet also help? This is a great question about optimizing your health to be resilient in the face of infections. Everything you suggested is important. Staying healthy by eating a nutritious diet, drinking lots of water, sleeping well are all important. So is getting the flu shot. It does not protect you from the coronavirus, but can help prevent the flu. All things that keep you healthy are important to keep in mind. Neha Padak, MD. Why are we being told not to wear masks, when most other countries are encouraging and even requiring masks? And when experts are saying masks won't help, why don't they differentiate between surgical masks and N95? There's a big difference between which one will help and which one won't. Great question, I'll take a stab at it. There are a few points. 1. In general, masks will not really reduce the chances of uninfected people from acquiring COVID-19. 2. If someone has a COVID-19 infection, or another respiratory viral infection, masks will reduce their risk of transmitting it to others. Many people wearing masks, N95 or surgical, do not wear them properly, continue to touch their face to adjust their mask, which can put them at greater risk of getting the infection, and often reuse masks, rendering them to be rather useless. Hand hygiene is key. Also, being mindful of not touching your face is helpful, albeit easy to say and hard to do. Isaac Bogok, MD. A lot of people have questions around masks, so here is some more information. The main thing to understand is that there are 2 main kinds of masks that people are referring to, the rectangular surgical masks, and the N95 respirator masks, the kind that healthcare workers get fit tested for. They are not recommended for the general public because surgical masks don't offer great protection. People often get a false sense of security when wearing them, and they may not do the things that will actually protect them, most like hand washing, not touching your face, eyes, nose. Also, wearing one throughout the day just means you are carrying around germs that you have picked up during the day. People also contaminate themselves when they remove the masks. The N95 masks are best left for healthcare providers who come into contact with high-risk respiratory infections at work, have been properly fit for these masks, and can dispose of them properly. It's also important to know that these masks can be very uncomfortable to wear when you are wearing them properly. If healthcare workers do not have access to these masks on the front lines, then they are at much higher risk than people in the general population. If you are sick with a respiratory infection or caring for someone that is sick, surgical masks can prevent droplets and splash that can lessen contamination of surfaces and exposure to others, but these are very specific situations, where people are especially vigilant about preventing the spread of infection. Is it true that sore throat and running nose are definitely not COVID-19 symptoms? This is not true. Sore throat and running nose can definitely be symptoms in some people. These symptoms are not, however, seen in most patients. I would caution against making assumptions of whether or not someone has this infection based on the presence versus absence of these non-specific symptoms. Some will have a fever, some will not. Some will have runny nose, many will not, etc. Michael Mina, MD, PhD. If one doesn't cough or sneeze, is he able to infect ones around him? I think about this a lot. If people have mild symptoms, or even no symptoms, they still may shed virus, and this has the potential to infect others. There is a small but growing body of evidence suggesting that this occurs in truly asymptomatic people. I believe that, on average, people with zero symptoms who remain asymptomatic are much less likely to transmit the infection than others. This is different from someone who has zero symptoms, starts to shed virus, but then develops symptoms of infection in the subsequent days. In general, I think that those with symptoms, including very mild symptoms, for example cough, are more likely to transmit the infection compared to truly asymptomatic people. Here is a case report of what may be asymptomatic transmission. https://jamanetwork.com/journals/jam/full article/2762028. Isaac Bogok, MD. What are early symptoms of a mild case? Thank you. According to the World Health Organization, 90% of people infected with the virus that causes COVID-19 in China developed a fever, 68% developed a dry cough, 38% reported fatigue, about a third of patients were coughing up sputum, or phlegm, about 1 in 5 developed shortness of breath. You can read the full report here. Brenda. My 35-year-old husband has severe eosinophilic asthma which has landed him in the hospital for a week. We are in Virginia. Besides hand washing and general precautions, is there anything else we can do to help him build up his immune system and lungs in case he becomes infected? Thank you. I'm so sorry that he has been sick. There is a lot that we are still learning about this virus, especially with regard to who is most at risk. The biggest things besides the precautions you mention are to take all of his medications as prescribed, get the flu shot to protect from the flu. Also, follow healthy lifestyle guidelines to optimize health, nutritious food, no smoking, plenty of water, stress management. It's also important to avoid sick contacts, those who are sick. These tips see and help prevent other respiratory infections besides COVID-19. Neha Padak, MD. Do you believe this has the ability to stay suspended in the air or is airborne? Right. Now, there seems to be person-to-person spread through respiratory droplets when an infected person sneezes or coughs, especially for those who are within 6 feet. The droplets can land on people's mouths, noses, eyes or inhaled into the lungs. There is also spread from contact with surfaces that have the virus on it, and then touching your face, nose, mouth, eyes. There also have been some reports of fecal-oral transmission and transmission from pregnant mother to newborn in China. There's still a lot we are learning about the spread of the virus. Neha Padak, MD. Can pets get the virus? Stupid question I know, but just curious. According to the CDC, as of right now, there is no evidence that pets can get this particular coronavirus, COVID-19, or transmit it to humans. Dogs and cats have their own versions of coronavirus different from this one, It's always a good idea to wash your hands after being around pets/animals, and avoid having a pet or animal lick your face. Neha MD. What can we do to reduce risk on domestic airline flights and at major airports in affected regions, ATL, SFO, etc.? The most important thing is to decide if you need to fly. To stay healthy on airline trips, make sure to keep your hands washed, avoid touching your face, especially eyes/nose/mouth after touching surfaces, practice good sneezing and coughing hygiene. Avoid touching surfaces when possible, use a tissue and then dispose of it, use your elbow to push open doors, etc. When you are sitting at your seat, use a disinfectant wipe to clean surfaces that you will be touching. Also, don't forget to stay hydrated, eat nutritious meals, and get plenty of rest to keep your immune system optimized. Neha MD.